Good morning, everyone. Chandra Prabha and I will be presenting on psychopharmacology, myths, and research. So, these are the contents that we'll be talking about: introduction, myths and facts, what researchers have to say, and then followed by a quiz at the end. So, moving on to the introduction. So, psychopharmacology is the scientific field that studies the effects of drugs on the mind and behavior. It typically includes the development, use, and mechanisms of action of medications that are used to treat mental disorders. The medications used in psychopharmacology are known as psychotropic drugs, and the medications are a crucial part of the treatment for many mental health conditions, and they're most effective when used in combination with psychotherapy. Psychotherapy, which is also known as talk therapy, is a type of counseling that involves talking to a mental health professional about an individual's thoughts, feelings, and behaviors. It can help one to understand and manage their symptoms, develop appropriate coping mechanisms, and improve their overall well being. So, moving on to myths, we've included some of the myths that are found in psychopharmacology. So, the first one is psychiatric medications change your personality. But the fact is that psychiatric medications are designed to alleviate symptoms of mental health disorders and they help individuals regain their normal functioning. They don't change one's core personality, but rather aim to restore balance in the brain chemistry and improve mood, thinking, and behavior. Next one is taking psychiatric medication means you're weak or crazy. However, the fact is that using psychiatric medication can only be used as a crucial part of the treatment and does not imply weakness
Harshita,
or
you're not audible.
insanity. Am I audible right now?
Yes. Can you start with the second point again?
Yes. So, the next myth is that taking psychiatric medication means you're weak or crazy. But the fact is that using medication for mental health issues is similar to using medication for physical health issues as well. It's a way to manage a medical condition and does not imply weakness or insanity. Seeking treatment is only a sign of taking proactive stress steps towards better health. The next myth is that once you start taking psychiatric medication, you will be in it for life. That's not true. The fact is that treatment with psychiatric medications is highly individualized. Some people may need it long term, while others may just need it temporarily. And they are dependent on many factors, such as including the nature of the condition and the client's response to treatment. The next myth is that all psychiatric medications are addictive. The fact is that most psychiatric medications, such as antidepressants, antipsychotics, are not addictive. Some medications used for anxiety or ADHD, like stimulants or benzodiazepines, have the potential for dependency if not used as prescribed. However, under proper medical supervision, they can be used safely. Next myth is that children and adolescents should not be given psychiatric medications. The fact is that when these medications are used appropriately and under professional guidance, they are considered to be safe and effective for children and adolescents. Early intervention can only significantly improve the long term outcomes for young individuals with mental health disorders. The last myth is that all you need is medication to get better from a mental health disorder. The fact is that medication can only be used as a crucial part of the treatment and also combined with other therapies such as cognitive behavior therapy, lifestyle changes, as well as social support, because a holistic approach will only help in yielding better results. Moving on to some of the fact checks. So, the first fact check is that antidepressants take time to work. Typically, they take about 4 to 6 weeks to show their full effect. It is crucial to follow the prescribed dosage and not to stop medication abruptly without consulting a psychiatrist to avoid withdrawal symptoms and relapse. Side effects are possible but vary greatly among individuals and can often be managed under supervision. The last fact check is that newer generation of psychiatric medications tend to have fewer and less severe side effects compared to the older ones. Over to Chandra Prabha.
Thank you, Harshita. Now we will be exploring some recent research in psychopharmacology, which covers a broad spectrum of topics, including the impact of drugs on behavior and cognitive functions. For comprehensive studies and reviews, the journal Psychopharmacology publishes cutting edge research, including clinical trials and experimental studies. And the journal Frontiers in Psychiatry also offers a rich collection of articles on psychopharmacology, discussing various mental health disorders and treatment methodologies. So you can refer to Springer Psychopharmacology Journal and Frontiers in Psychiatry. Moving on, let's talk about all of the discussions in research. So, firstly, effectiveness and benefits. Medications can be crucial for managing symptoms of severe disorders like schizophrenia, bipolar disorder, and major depression. For instance, antipsychotics, mood stabilizers, and antidepressants have been found to be effective in reducing symptoms and improving the quality of life for many patients. Combination. So, a common perspective is that psychopharmacology is most effective when combined with psychotherapy, which we also shared in the myth section and fact section. The integrative approach of medication and therapy addresses both the biological and psychological aspects of mental disorders. So, for example, CBT combined with antidepressants is more effective in treating depression than either of the treatments alone. Additionally, the trend towards holistic and integrative approaches in mental health care emphasizes combining psychopharmacology with lifestyle modifications such as diet, exercise, and mindfulness practices. Researchers also support the idea that integrating these elements enhances the overall effectiveness of treatment and promotes long term mental wellness. There are some concerns about overprescription. As sometimes medications are prescribed as a first line treatment without adequately exploring non pharmacological interventions. So, this perspective emphasizes the importance of a thorough assessment and consideration of therapy along with lifestyle changes. Of course, there are side effects and long term impacts. Many medications come with potential side effects ranging from mild, for example, weight gain, drowsiness, to severe, example, increased risk of diabetes or tardive dyskinesia. Researchers are particularly focused on understanding the long term effects of these medications, especially since some may affect brain chemistry and function over extended periods of time. Next slide, please. Now, talking about personalized medication, this approach involves tailoring medication choices and dosages based on individuals' genetic, biological, and psychological profiles. So, advances in genomics and neuroimaging are helping researchers predict which patient will benefit most from specific medications, potentially increasing the efficacy and reducing the trial and error process often involved in finding the right medication. Next. There are ethical and societal implications because issues such as the influence of pharmaceutical companies on prescribing practices, access to medications, and the potential for misuse of psychotropic drugs are important areas of concern. There is an ongoing debate about the role of medication in society and the need for policies that ensure ethical practices and equitable access to mental health care. Role of neuroplasticity. Medications like antidepressants are thought to facilitate neuroplasticity, allowing the brain to form new neural connections and recover from the damage caused by mental illness. So, understanding how medications are influencing this, it can help in developing effective treatments. However, this is it has research has found that it has been very effective in rehabilitation strategies. Impact on cognitive function. So, there are medications that we have heard about improve cognitive symptoms associated with mental disorders. However, there are others that also impair cognitive functions such as memory, attention, executive functioning. Next point. Cultural considerations. So cultural factors definitely do play a significant role in the perception and acceptance of psychopharmacology. Psychologists and researchers highlight the need of culturally sensitive approaches to prescribing and discussing medications. Cultural beliefs about mental health and medication have been found to influence treatment adherence and outcomes, necessitating tailored approach. Next, pediatric and adolescent use has been, even in India, it has the use of medications in pediatric and adolescents. There is a rise in it. The use of psychotropic medications in children and adolescents is also under significant debate. While these medications are beneficial for young patients with severe mental health issues, there is concern about their impact on developing brains and the potential of long term side effects. There are researchers that are advocating for careful monitoring, conservative, and using conservative prescribing practices and prioritizing non pharmacological interventions whenever possible. And lastly, we'll talk about resistance and alternative treatments. So, medication resistance, where patients do not respond to standard treatments, is a critical issue in psychopharmacology. There are alternative treatments that are being explored, such as neuromodulation techniques, example transcranial magnetic stimulation, and electroconvulsive therapy, and novel pharmacological agents to address treatment resistant condition. Next, there are a lot of advances in research as well. Recent advances in psychopharmacological research are also shaping perspectives. So, innovations in drug development, such as the exploration of psychedelics, example MDMA, and psilocybin, are for treating conditions like PTSD and depression, are opening new frontiers. These novel treatments are supported by growing evidence from clinical trials, although they also bring new challenges and questions about regulation and safety. And lastly, global health perspective. There are new research and papers and articles emerging on the global health perspective on psychopharmacology. There are disparities in access to the accessing these treatments. There is ongoing work to improve the availability and affordability of mental health medications in low and middle income countries. This involves addressing logistical challenges, ensuring the quality of medications, and integrating psychopharmacology into broader mental health care systems. So, this was some pointers from the research. Now, let's move on to a couple of questions. Um, which concern is commonly raised about the prescription of psychotropic medication? They are too expensive, they are only available in hospitals, they are overprescribed without considering other interventions, they are ineffective for all mental health conditions. Right, the answer is C. They are overprescribed without considering other interventions. Next question. What are some potential side effects of psychotropic medications? Increased risk of diabetes and weight loss, weight gain and increased risk of diabetes, heightened alertness and weight loss, no significant side effects. Yes, psychotropic medicines have been found to aid weight gain and increase risk of diabetes. Next question. Which approach is growing in popularity for combining psychopharmacology with other health practices? Psychopharmacology and technology use, holistic and integrative approaches, exclusive use of psychotropic drugs, or psychopharmacology and educational programs? Yes, it's holistic and integrative approaches. All right. Thank you, everyone.